Somatic therapy is at its core the same as any other therapy. Transformation happens through empathy and compassion. But what makes this therapy different is we bring the body into the room as well. Our bodies react to everything we experience in life. It's where our nervous systems operate, telling us when to be cautious and when to be relaxed. It's where we experience both danger and safety. And that sense of safety is really what therapy is trying to help us restore. We can see this in the way that we breathe, in the tension that we carry, or in the numbness that cuts us off from feeling. The body is also the realm of the unconscious and the right brain. Our early life experiences shape how we feel about others, how we expect to be treated, and how safe we feel in relationships. And these patterns show up in our bodies. True healing happens when our thoughts and our feelings work together, when our left and our right brain integrate. Healing begins when we can bring what was hidden into awareness and choose how to respond. That's why somatic therapy isn't only about talking. It gives us ways to express ourselves without words. For example, if you've been hurt in relationship, you might expect everybody to treat you in exactly the same way. What you need is a reparative experience of relationship. The compassion and attention of therapy can provide that, and even more so if you begin to give that to yourself. Somatic therapy also offers right to right brain co-regulation, which is simply a mirror of safety. I'd like to pause here and guide you through a short practice so you can experience this rather than just hearing about it. Take a moment to get comfortable. You can do this lying down, sitting up, or standing. Just be comfortable. Close your eyes if you're willing and take a moment just to tune into your body. Notice your breathing, your shoulders, your jaw, your belly. Is there any tension there? Is there any numbness? Where feels good or more alive? Now see if you can give words to what you're noticing, like tight chest, heavy stomach, or buzzing in the arms. Don't overthink this, just name whatever you're feeling. And now bring your attention to just one of those places. And if you'd like, just place your hand gently in that area and breathe into it, offering it space and kindness. You don't have to change anything here. Just soften around it and be gentle with it. Allow it to be exactly what it is with compassion. And then just take a couple of breaths, and when you're ready, open your eyes and come back into the room. And of course you can pause here if you need more time. This is a tiny example of how somatic therapy works. Noticing your body, giving language to that experience, and then meeting it with empathy. Over time, this builds your capacity to tolerate distress, to soften defenses, and to feel more at home in yourself. Somatic work uses different tools like your breathing exercises, or movement, or just paying attention to your body. I also include exploring your belief systems, connecting with different parts of yourself, and inner child conversations. These approaches fit beautifully with body-centered work. Neuroscience also supports this work. When what was unconscious becomes conscious, we're able to pause, reflect, and choose differently instead of automatically responding or reacting. The therapist is also part of this process. A somatic therapist pays attention to their own body as well. I'm listening to my body at the same time as helping you to explore yours. And when it's useful or helpful, I bring that into the work. At its best, somatic psychotherapy offers something profound. A space where healing starts from the inside out, from how you feel within yourself, rather than from what you think others expect of you.